Medicare has finally announced the 2025 Medicare cost increases for premiums, deductibles, and copay hikes for the different parts of Medicare. So let's go over how much you're going to need to pay for Medicare in 2025. Parts A and B make up what is called Original Medicare. These are administered by the federal government. Part A is your hospital coverage, meaning if you are admitted into a hospital, it's like your rent to stay in the hospital. So Part A covers that and a few other things like skilled nursing, some home health care, and hospice. Let's start with the Part A premiums, or the monthly cost that you need to pay just to have the coverage. Now, 99% of Americans pay $0 in premiums because you or your spouse have worked at least 40 quarters, which is the equivalent of 10 years, and you've contributed to the Medicare system through your taxes. This hasn't changed. It's still $0. For those who do not have enough work credits, either by yourself or through your spouse, you have a monthly premium, and it is based on the number of work credits that you have accumulated over your life. For those who have only worked between 30 and 39 quarters, the monthly premium is now $285 per person per month. That is up $7 from what it was in 2024. If you have worked fewer than 30 quarters, that premium is now $518 per person, a $13 increase per month over the 2024 costs. Remember, you can still qualify for premium-free Part A through your spouse's work record. So if your spouse does have the work credits and you don't, you can still get the premium-free Part A as long as your spouse is 62 years old. If you are turning 65 without full work credits, but your spouse who does have the work credits isn't 62 yet, you're going to be paying that premium. Let's move on to the other Part A costs. Part A has a unique deductible and then some copays that we need to be aware of. The dollar amounts for both have changed for 2025. The Part A deductible is the dollar amount that you would need to pay first before Part A starts to cover anything. This mostly comes into play for those who have original Medicare only and you do not have something like a supplement plan or an Advantage plan. The Part A deductible is not an annual deductible like you are probably used to with most insurance plans. It is what is called a per benefit period deductible. What this means is that you could see multiple Part A deductibles in 1 year. The Part A deductible amount for 2025 increases to $1,676, an increase of $44 over 2024. This deductible amount covers your first 60 days in a hospital. If you stay longer than 60 days, you will have additional daily copays. For days 61 to 90 in 2025, the copay is now $419 per day. That is up $11 per day over the previous year. For days 91 through 150, which are referred to as your lifetime reserve days, the copay is now $838 per day, which is up $22 per day over last year. The final changes to your Part A costs in 2025 revolve around the copays for skilled nursing facilities, as these are a Part A expense. After you pay your Part A deductible, the first 20 days in a skilled nursing facility are covered 100%. For days 21 through 100, you have a daily copay of $209.50 per day. This is up $5.50 per day over last year. For all days over 100, so 101 plus, you are still responsible for 100% of those costs as they are no longer covered by Medicare Part A. These all increased, which is expected. Nobody likes increases, but for Part A, we're looking at about a 2.6% increase on each of these costs, and frankly, that's not that bad. Why do I say that? Because it is close to the 2025 cost of living adjustment increase on Social Security. You'll see what I mean by that here in a minute. Now, if you are new to the Medicare conversations and these costs just made you feel a whole lot worse about your future life on Medicare, the good news is that most people choose to get either a Medicare supplement plan or a Medicare Advantage plan, and both of these do a great job covering most of these Part A gaps that we just talked about, but they accomplish it in very different ways. We have a lot of videos about this on our channel, so make sure you go watch those and you should feel a little bit more at ease around these Part A costs. All right, let's move over to Medicare Part B. This is your medical coverage. Think doctor visits, labs, x-rays, chemotherapy, and a bunch of other things. This is much more applicable to everyone because everyone on Medicare deals with Part B costs in one way or another. Medicare Part B premiums tend to increase each year, so your 2025 base Medicare Part B premium is now $185 per person per month. This is an increase of $10.30 per month and 5.9% higher than 2024 Part B premiums. Contextually, this increase is sitting right around average. Now, if we look all the way back to when Medicare first started, the average increase is 7.7%. But if we look at the last about 20 years, the average is 5.6%. So this is really close to what we've been seeing as an average increase over the past 20 years. Also, the Social Security Cost of Living Adjustment, this is the additional amount that they give Social Security beneficiaries each year, will increase 2.5% for 2025, meaning that your Social Security income just went up 2.5%, while your Medicare Part B premiums are up 5.9%. This means that your healthcare fixed expenses as a percentage just went up at a higher rate than your fixed income amount. This is why I said Part A isn't so bad, because it's basically the same as the Social Security COLA, but Part B tends to outpace Social Security increases, in this case by more than double when looking strictly at percentages. Now, your Social Security check is a bigger number, so 2.5% of a number in the thousands is a larger number than 5.9% of $175. But Medicare Part B isn't the only thing in your life that is going up. You have your general life's expenses, and it's not even the only thing specific to Medicare going up. Supplement plan increases are up by an average of about 10%. Advantage plans saw an increase to the maximum out-of-pocket cost by an average of about $300 a year, and we still have some more costs to go in this video. All right, remember your Part B premiums are based on your income from 2 years ago. So if you're a higher income earner or you had a big year 2 years ago because maybe you sold a property or you sold some investments, your Part B premiums will be higher by an amount called the Medicare Income Related Adjustment Amount, or IRMA. Here is the updated chart for 2025. Something to note is that most of the income brackets increased over last year by about 2.9%, meaning instead of $103,000 and under for the base premium last year, if you are filing as a single, you would have to have had a modified adjusted gross income over $106,000 in 2023 to affect this year's premium in 2025. Again, that is in your income from 2 years ago, or over $212,000 as a couple, and these dollar bumps carry through other brackets as well. Along with the Part B premium increase, we will see an increase to the Part B deductible. Again, this is the dollar amount that you need to pay first before Part B starts to help. If you are on any Medicare supplement plan that is not Plan F or Plan J, you pay this amount as well before your supplement plan starts to kick in. For 2025, the Part B deductible will be $257. That is up $17 or about 7% over 2024. Unlike the Part A deductible, this is an annual deductible. Once you meet it in the year, you're done for the rest of the year and it will reset in January. Okay, that wraps up the original Medicare costs. We're now going to move away from original Medicare and over to Part C and Part D, which are no longer administered by the federal government. They are heavily regulated by the federal government, but they are not functionally carried out by the government. They are run by private insurance companies who take care of the risk and the coverage options of these plans. Part C refers to Medicare Advantage plans. 7% of Medicare Advantage plans have been eliminated in 2025. They went away. Of the 93 that are still around, the average Advantage plan premiums went down from $18.07 down to $17.47, with the vast majority of Advantage plans maintaining a $0 premium plan. In 2024, it was 75% of all Americans on an Advantage plan were paying $0. That will likely bump down a little bit, but it's still the vast majority of people are paying $0 for Advantage plans. The big shift here in 2025 is in drug deductibles for Advantage plans. Something called the enrollment weighted average refers to an average number based on where seniors are actually enrolled. If we have two plans and one is $0 and one is $100, but 99 people are on the $0 plan and one person is on the $100 plan, the arithmetic average is $50, but the weighted average is $1 because so many more people are on the $0 option. So the enrollment weighted average drug deductibles for Advantage plans is going from $176 in 2024 as an average up to $309 in 2025. That is a 76% increase due to the intense ripple effects of the Inflation Reduction Act changes that are taking effect January 1st of 2025. In 2024, 60% of everyone on an individual Advantage plan had a $0 drug deductible. If everyone were to stay on their current plan for 2025, only 31% of that same group would have a $0 drug deductible. There will be people shifting around there, so that isn't a final number for 2025. It just represents what the number would be if people did not switch plans, and it shows that a lot of these Advantage plans are shifting their drug deductibles. The last thing on Medicare Part C or Medicare Advantage plans would be the maximum out-of-pocket numbers. This one actually surprised me a little bit. The national average maximum out-of-pocket in 2024 was $4,644. In most of my videos, I round that to $5,000. For For 2025, the average is going up by a little over $300 to $4,973, only about a 6.5% increase, which is close to the things like Part B, but well below the deductible percent increase. The federal government does regulate the highest maximum out-of-pocket that Advantage plans are allowed to have. In 2024, for in-network services, the highest maximum out-of-pocket allowed was $8,850. In 2025, that goes up to $9,350, a 5.6% increase. Now, PPO plans have a separate out-of-network maximum out-of-pocket. In 2024, the highest allowed was $13,300. In 2025, that goes up to $14,000, a 5.2% increase. Now, very few plans have that high of a maximum out-of-pocket as evidenced by the $5,000 average, but there are plans that do. This is just the absolute federally regulated maximum max out-of-pocket that an Advantage plan can have. Okay, now let's move to Part D, or your prescription drug coverage. This is also administered by private insurance companies, and this is an absolute mess in 2025. These numbers have all been released prior to most recently, but 2025 is the full implementation of the Inflation Reduction Act's $2,000 maximum out-of-pocket for drug coverage. Before 2025, there wasn't an official cap on your costs, so the fact that there is a max out-of-pocket is great for those with high-cost medications, as is the nature with insurance. By capping costs, that puts more liability on insurance companies, who then shift that to you in the form of higher premiums, higher copays, higher coinsurance, and shifting drug formularies and tiers. Something that is important to note here on that $2,000 maximum out-of-pocket is that it applies to drugs that are on formulary. So if you have a drug plan, but you're taking medications that are not included in that drug plan's formulary, the list of drugs that plan will cover, then that $2,000 maximum out-of-pocket does not apply. You will see much more than $2,000 as your costs. And this is a big thing that we're hearing a lot as people reach out to us, is they're saying, look, the $2,000 max out-of-pocket is great, but for the medications that I was taking in 2024, I can't find a plan that has them on formulary anymore. A lot of these insurance companies have adjusted their formularies to where now those medications aren't available, and that $2,000 max out-of-pocket doesn't really come into play. Or the plan that they had was a reasonably cost drug plan with low monthly premiums that covered their drugs, but now that plan in 2025 does not cover that medication anymore, and the only plans that do are really high premium plans. So there's a lot of shifting going on here with drug coverage. Make sure you're checking your annual notice of change. Make sure you're checking your drug plans for this next year. I have a video right here that goes over exactly how you can find the lowest cost drug plan for you in 2025. Now, according to CMS's most recently published release, the average premium in 2024 was $53.95. They are saying that the average premium is going down to $46.50 for 2025. A big reason for the stability is the recent bailout from the government to standalone drug plans, which helped minimize the impact. Let's hope that rates stay stable for next year. I don't really know what to tell you here. There is what they are telling us, and then there's what you and I are seeing in real life. What I have to guess is that they are doing some sort of a weighted average here. There are $0 drug plans. They are very low cost, and they are able to keep those costs low with lighter formularies, and those insurance companies have cross-selling opportunities. If you have no medications or just a few low-cost medications, these plans are great. Low or no costs, they help you avoid the Part D penalty. If you do have higher cost medications and you're not looking at these super low cost plans because your drugs aren't on formulary, people are seeing 400, 500, 600% increases in their Part D drug plan premiums. So it's hard for me to tell you that, hey, look, CMS says this is good news. Everybody's Part D premiums are going down, when in reality, that's just not what we're seeing. But according to CMS, 2025 Part D plan premiums are going down. There are plans that did go down, but there are more plans that went up. Now, how you will be impacted will be based on your medications and which plans cover your medications most effectively. Again, I have that video that looks over how you can go into finding the lowest cost drug plan for you. Make sure you check that out for 2025. All right, remember, your Part D premiums can also be adjusted based on your income from 2 years back. Just like the Part B IRMA amounts, you also have Part D IRMA brackets. They are also seeing a bump of about 6% along with each of the income brackets. Part D is unique in that you will have a monthly premium for your standalone Part D plan if you go the supplement plan route, but Advantage plans often come with a Part D plan included at no cost. But if you're subject to the IRMA, you would still see an IRMA amount deducted even if you're on a no-cost Advantage plan. It will just get added onto that $0 coverage of whatever level you're at. But for the millions who go the supplement plan route with a standalone Part D plan, you will need to pay a monthly premium just to have that coverage. And then if you're a higher income earner in retirement, you've got to add that IRMA amount that you would see here on top of whatever premium you're already paying for Part D. So if I have a standalone Part D plan that has the average cost of $47 a month, and I'm in this income bracket, my new premium for that year becomes $82.30 per month. And if you are married and filing jointly, you are each paying that amount. Finally, the Part D deductible went from a maximum of $545 in 2024 to $590 in 2025, an increase of $45 or a bit over 8%. Okay, here are the percentage increases all laid out on one screen. Healthcare cost increases cause worry for many of us, and I get it. I'm worried too. I'm not sure where this all ends up. If you use the rule of 72, it tells us that if we're averaging a 6% increase each year, costs are going to double every 12 years. We try on this channel to help you understand how Medicare works, and then if you reach out, our goal is to find you the plan arrangements that will give you the healthcare cost protection and coverage that you need at a price that makes sense for you. We have several videos on financial topics as well, specifically around financial planning and money management, in hopes that it will help us find ways to grow our income sources at a pace that can hopefully match the expenses that are coming as increases, because Social Security was never meant to replace all of your retirement income. It will never keep up with the percent increases of everything else that you are experiencing. We are here to help however we can, so if you do watch these videos and you would like to talk to somebody about your situation, you can reach me at theretirementnerds.com. Again, we help with Medicare, Social Security, financial planning and investment management, and estate planning. For those of you who made it this far, the secret code word is your favorite season. I am a huge fan of late summer. I am not a fan of the colder weather of winter. So where do we go from here? Healthcare costs rise almost every year. Original Medicare costs go up. Supplement plan costs go up. Drug costs in the insurance plan to cover these costs go up. The biggest question in Medicare is, what plans do I get that will cost me less but still cover what I need? And most people choose between a Medicare supplement plan with a standalone Part D drug plan or a Medicare Advantage plan that comes with drug coverage. There are other options, but the choice between these two is what most individuals need to address. This is a video that outlines in detail how much you could expect to pay on a Medicare supplement plan with a standalone Part D drug plan versus a Medicare Advantage plan. There is so much more to this than just the costs that would go into this decision, but that'll give you a good starting point around your costs. I will see you over there.